So we used to tell women to limit their exercise so that they didn't go over a certain heart rate, say, or didn't lift a certain amount of weight. But now the advice that we give women regarding exercise in pregnancy is more individualized. If a patient is in shape and exercising before pregnancy, we really want her to continue that throughout the pregnancy.
How recent of a change is that?
Over the last decade or so.
And like the person I'm doing a story with, I haven't heard from her, but she was supposed to be induced today, and was still working out Monday. Is that something that, and she works out regularly as a fitness coach, so you're saying like that's totally good. She knows what she's doing.
Oh, yeah. I think that if women can continue an exercise program throughout their pregnancy, it will really benefit them both physically and emotionally. Certainly, with certain programs, it would be good to be able to scale back and modify the workouts depending on which trimester you're in. But again, to use, definite cutoffs that would apply to every patient would be a mistake. I think each patient needs to really listen to their body and not try to push through if their body is telling them they're overdoing it. So if they are having symptoms of preterm labor, they need to listen to that and back off.
And like working out up until the week of birth, is that sort of kind of the newer thing, or like the last 2 years or so?
No, I think that's always been just something that we really talk with patients about and individualize the advice that we give. For instance, if a patient is running, as they get to the end of their pregnancy, they may feel like they're not able to stay on balance quite as well, and so they may need to just back off on the intensity of their workout and not put themselves at risk of having abdominal trauma by falling.
But what are some of the benefits of continuing to work out? Do you see them after birth, or does it make the pregnancy smoother?
So physical activity in general and keeping your body mass index in a normal range has many health benefits during pregnancy and afterwards. Emotional well-being, you're going to have patients really stay healthy emotionally during the pregnancy and then probably be at lower risk for having postpartum depression after they deliver. And then their state of health and fitness is going to return a lot sooner after they deliver if they've stayed fit during the whole pregnancy.
Is there anything I didn't ask you?
So there are some just physiologic changes that happen in pregnancy that women who are going to do something as intense as CrossFit just need to keep in mind. The ligaments in your joints just become more lax in pregnancy, and so you can be at risk for having hyperextension type injuries a little bit more in the second and third trimester of pregnancy. After about 15 weeks, you want to avoid just lying flat on your back because the weight of the uterus on your vena cava can decrease blood flow and return to the uterus. And then always trying to avoid abdominal trauma. So I haven't done CrossFit, but I've seen videos of people climbing ropes up to the top and, really being high, where if they did slip or fall, and they do have to take into account their different weight in the front, then they might be at risk for abdominal trauma, which could endanger their pregnancy. And then patients who have been told that they're at high risk for preterm birth need to individualize their plan even more so with their provider. But I think in general, most OBGYNs are really supportive of exercise.
Easiest question, just so I don't mess anything up, if you just say it's my last name.
Suzanne Dixon, Dixon, Suzanne. And Dr. Dixon, I'm a general OBGYN at Mayhec OBGYN.
Anything else?
No, one of our recent, we have OB fellows that come through that are family medicine doctors that study for a year to do C-sections. And one of our recent graduates did CrossFit all the way through her pregnancy and did very well. So.
Is that something you're hearing more about?
I think as CrossFit becomes more common and more popular, we're going to have more and more patients that want to keep doing that. I do think it's a little bit different if you are a total couch potato when you become pregnant and then you want to start something like CrossFit. You would probably have to talk with your coach about really taking baby steps and easing into it. But my understanding is that there are all kinds of levels available when you start.